The client who has been prescribed phenytoin for epilepsy calls the clinic and reports a measles-like rash. Wow. What an important question here. What an interesting scenario. Which intervention should the nurse implement? So the first thing that I want you to recognize here is that we are not dealing with a pediatric patient. Okay? For several reasons. Number one, unless it says a pediatric patient, a 5-year-old, an 8-year-old, a 9-year-old, it is always an adult. First reason. Okay? So, first reason why this is an adult. Second reason, this patient called the clinic and reported something. Hey, I have this measles-like rash. I have this rash on my body. So, after the nurse receives this information, what should the nurse implement? Notice that on this question, it doesn't say intended effect or effective. It doesn't say side effect. It doesn't say adverse effect. So the information that I just gave you about intended, side, and adverse effect is hidden in this stem of the question. It's not as obvious. It's not clearly stated. You could see many questions on the NCLEX where this is hidden. It's not clear. But the scenario that they're giving you deals with an adverse effect of phenytoin. But nowhere on the stem of the question it states adverse effect. But also, it is important to know that the patient calls and reports a measles-like rash. The words report means there is a change in condition. Okay? In scenarios that deal with change in condition, we usually have to really analyze those scenarios. This is not going to be an easy question. Answer number one, instruct the client to come to the clinic immediately. Remember, the adverse effect, I gave you that information, but it's not on the stem of the question. So maybe some of you failed to recognize that this is a scenario dealing with an adverse situation, an adverse effect situation. So let's say that you read the question and you feel a little lost. Measles-like rash? Why? Why this rash? And maybe you don't recognize, maybe you didn't read that part of the book. Okay? So answer number one says, hey, patient, this is a big problem. Patient, this is an adverse effect. Come to the clinic immediately. So answer number one tells me that this is an adverse effect. So AE, the initials that I'm putting here, AE means adverse effect. So keep that in mind. Answer number two says, determine if the client is drinking grapefruit juice. Implement. This is an implementation. This is an assessment. We're going to leave that assessment there. Let's not mess with that assessment, because assessment is super important, especially if we're dealing with a phone call. We don't have a lot of information. So let's leave that one there. Answer number three, encourage the client to apply a hydrocortisone cream to the rash. So what is the difference between answer one and answer three? Answer one says, ding, 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 emergency, come to the clinic immediately. Answer number three says, it's okay. Just apply some hydrocortisone cream to the rash. So one is saying this is an adverse effect, come get treated. Answer number 3 kind of says, oh, this is normal. Just apply some hydrocortisone cream. So several things wrong with answer number 3. The first thing that is wrong is that we're giving an advice on medication administration that it is not under our scope of practice, especially if we haven't really assessed the patient, because we are receiving information from the patient that some rash just appeared. But answer number 1 seems to be adverse effect, while answer number 3 seems to be, or the nurse recognizes as a side effect, a common side effect. So answer number 1, the nurse recognized this is an adverse effect, come to the clinic. Answer number 3, the nurse is saying, oh, this is normal, just put some cream. You see the difference? So answer number 1 and 3 are opposite to each other. Answer number 4 says, explain that this is a common side effect of this medication. So what is the relationship between 3 and 4? The same thing. In answer 3 and 4, the nurse got the information and analyzed it as a side effect, a common side effect that does not need emergency medical treatment. While answer number 1, the nurse recognizes that this is an adverse effect and needs emergency medical treatment. So how can we use critical thinking here to select and eliminate answers? Well, there is a strategy that you can use. Answer 3 and 4 are similar. 3 and 4 similar. And answer 1 is opposite. What does the strategy say? In a prioritization question, when it is not a select all that apply, answers that are similar are eliminated and the opposite answer is selected. Not always, but on most cases. So even if you're lacking knowledge here on what these measles-like rash represent, you can use the comparable or alike strategy to eliminate answers and select the correct answer. So using this strategy, the correct answer is 1. But you can say, well, Professor, what do I do with answer number 2? The grapefruit juice question. Because I know that many medications cannot be taken with grapefruit juice because grapefruit juice affects the absorption of medication. Yes, it's true. Grapefruit juice affects the absorption of many medications. But this question is not about a subtherapeutic effect of a medication because grapefruit juice is affecting the absorption. The question is about side effect or adverse effect. So answer number 2 does not make sense, and the correct answer is answer number 1.